In medical schools in the United Kingdom, being in primary care or at a GP placement, the whole concept and idea of it seems boring and unappealing to many students. But I promise you, and this is coming from someone that usually viewed primary care or the GP lifestyle as being very boring, I really loved it. I loved it, it was fantastic, and I'd love to do it again. So I spent 8 weeks, rather 8 days really, shadowing GPs. We all did as part of our mandatory placement, and I'm here to tell you that you create your own experience. If a person tells you that GP placement is very boring and you won't get much out of it, I promise you they are completely wrong. Again, you create your own experiences. You can thrive regardless of where you are. You can make the most out of your primary care placement, and I'm here to tell you how to do so. 90% of patient interactions in the UK happen in primary care settings or in GPs. This is not a small number, and this really just means that being a GP is a very important job, and there's so much you can learn from it. One of the doctors that I shadowed at the GP clinic, she told me, "Nice to meet you, you're a first year medical student, I don't expect you to do much, you can sit at the back, if you've got any questions at the end, please let me know." I said, "That sounds great," but we actually had learnt a few basic things. For example, taking pulse readings, taking blood pressure readings, taking temperature, doing certain minor types of physical exams, learning some forms of breath sounds and heart sounds. So essentially like small things that you can do in clinic, including urinalysis. I told her that I really wanted to use these skills, employ these skills on patients if she allowed me to, and to actually learn and do more under supervision. I told her that we've learned a lot of skills at med school and I want to employ these skills and I actually want to practice them. I told her that this would be an excellent learning experience for me. I'd really just love it if she could let me do. So I explained this to her in a very genuine tone, with a lot of excitement in my voice, because at the time I really was excited. Don't be shy. If you present yourself, if you tell your GP or the primary care doctor that you want to do stuff, you want to participate in these basic things, for example, taking certain types of readings, taking certain types of physical examinations, doing a urinalysis, assisting with something, for example, they will let you. In a teaching hospital or a teaching primary care setting, their job is to teach you. It sounds cheesy, but their job is educating the next doctors of the next generation, sort of thing. So present yourself, tell them that you've learned things, and even if you haven't, tell them if you can do basic things in clinic. They will allow it. I promise you they will allow it. There is absolutely no way they wouldn't. Unless it's a pediatric patient that's extremely young, or a patient that doesn't allow a student to examine them. That's completely fine. So she was impressed by this, and the next patient that came in, she gave me gloves. She said, "Do you know what you're doing?" I was like, "No." She said, "Urinalysis." I was like, "Great, let's do it." We did a urinalysis. I told her what the readings meant because we'd learnt it just really fresh. It was really fresh in my memory at the time. Now I do remember it pretty well. But I did it successfully. She agreed with what I did. She agreed with my findings as well. I was so pleased with that. So since then, every day at the GP, I've been doing cool things. Whether this be taking blood pressure for every patient, pulse readings, respiratory rate, listen to heart, chest sound. However, listening to sounds is slightly more advanced. It takes a lot of training. Generally, your GP would do it for you, but they'd also let you have a listen if there's something interesting or key to be heard. The next point is asking questions. Keep asking questions. After the patient leaves or right before the patient comes in, I would say, "Alright, this patient, what do they have?" So the GP would tell me what symptoms the patient will be presenting with and exactly what's wrong with them. And with the limited knowledge that I have as a first year, I try to understand what could be wrong with them, and I'd put forward reasonable suggestions and I'd ask them what they do, and oftentimes I'd probably be right as well. Oftentimes I'd actually guess the diagnosis very accurately, which was very cool. And then we'd let the patient come in if you don't understand anything or something's very interesting, that sort of thing. After the patient leaves, you ask questions, you will learn so much, I promise. In medical school, we learn things through PowerPoint, through book, or through making notes. However, learning on the job and actually asking questions on the job will help you learn so much more. It's actually amazing. Being actively involved in patients' care and putting this scientific knowledge that you've acquired throughout med school, throughout the first months of your med school, and applying this in clinical context will help so much. For example, we read about atrial fibrillation. We learnt everything about it. We learned how to interpret it on an ECG, how it presents within patients, potential risks, treatments, etc. However, when we actually saw a patient with atrial fibrillation and we examined their radial pulse to see what it felt like, and we saw some of that patient's past ECG readings, it puts things into so much more context, and that sort of humanizes medicine. Also the human and individual aspect of how that individual copes and lives with that ailment, and how you can treat them. Now the last thing, if you feel confident enough, is with supervision of your GP, ask them if you can take a patient history. This is something I didn't do on my primary care placement because it really occurred to me late. If it occurred to me earlier that I could have done that and I should have done that, I would have done it much sooner. But I am at hospital placement now, so that is something I will be doing, with their permission of course, if you can take some form of history. If they allow it, that's great. If they don't, that's completely fair enough. So go over details as to how you take a patient history, learn a bit about it, and well, if they let you take a history, it'll be pretty enriching for you. But overall, everyone, the main thing is being proactive. This was a very short video, but the main message I'm trying to get across is be proactive, keep talking, keep asking. Good things come to people that ask. Good things come to people that are proactive and take initiative. And students that show the most enthusiasm end up learning the most, and that's, well, in the end, what we're here to do. You will enjoy primary care placement, you will. And based on everything that I've just told you and the potential things that you can do if you simply present yourself to your GP as being someone that's competent, as being someone that's interested and enthusiastic to learn more. Very short video, just a quick one for everyone starting primary care placement or just placement in general. I hope you enjoy, I hope you have a great time, and I hope you learn so much. All the best for the future, and I'll see you in the next one. Bye.